Chapter 4, Order Entry and Processing. This is out of the Pharmacy Technician Exam Review book. So for Domain 1, Overviews and Laws for the EXCPT exam, if you choose to take this one, interpret basic medical terminology commonly used in the pharmacy, tailor communications to different audiences, including patients, caregivers, staff, and healthcare professionals, interact with customers and patients in a professional manner, including internal and external customers, confirm final product verification has been completed by pharmacists prior to release to patient. Domain 3, dispensing process. A, prescription and medication order intake and entry. 1, analyze the prescription or medication order for completeness and obtain missing information. Process prescription orders, process prescription refill authorization requests from prescribers, obtain information for the patient profile from patients such as demographics, medication history, health conditions, concurrent medications, allergies, and third-party payers. Enter and maintain electronic patient profiles, identify and input third-party payer identifier numbers, process third-party prescriptions, communicate with patients, providers, and/or third-party payers about prescription coverage, translate prescribers' directions for use into accurate and complete directions for the patient, interpret abbreviations used on prescriptions or medication orders, enter prescription information into the computer, use correct DAW codes when entering prescription data into the computer, respond to electronic alerts while processing a prescription, process durable medical equipment prescriptions, including coordination of benefits with Medicare Part B or D. Preparing and dispensing prescriptions, identify medications that require special handling procedures, stock and use automated dispensing machines, select appropriate medication based on prescription legend, OTC or BTC status, name and strength, NDC number, expiration date, and lot number, count and measure or pour out medication into appropriate container, select appropriate vials, caps, bottles, and other supplies. Label medication products packaged in approved containers or when appropriate in original packages. Select and apply appropriate auxiliary labels. Provide printed pharmacy information leaflets and required medication guides. Package and ship medications according to manufacturer's recommendations. Select appropriate OTC product based on pharmacist recommendation. Offer pharmacist consultation to patients. Calculations, convert within and between each of the systems of measurement, calculate the quantities of prescriptions or medication orders to be dispensed, calculate the day supply for prescriptions, calculate individual and total daily doses, perform sterile and non-sterile compounding calculations, perform basic math, brand name medications, I have a generic available, expensive medications, medications with age limits such as Retin-A, drugs used for cosmetic purposes such as Propecia, medications such as Cialis and Viagra prescribed for non-life-threatening medical conditions, drugs not usually covered by the insurance company but said to be medically necessary by the physician, medications that are usually covered by the insurance company but are being used at a higher dose than normal. Third-party adjudication involves submitting a prescription for payment by a third-party drug insurance provider. If the prescription drug insurance company denies the payment, the patient is responsible for a full payment of the prescription unless the rejected claim is corrected and submitted to the third-party prescription drug provider. Information that is transmitted during adjudication. So all of this patient information, prescriber information, pharmacy information, prescription information. Patient's relationship to cardholder will need to be entered. Many plans use the following relationship code: 01 for the cardholder, 02 for spouse, and 03 for dependent. Information contained on a prescription drug card. So the BIN number, the plan code, the group number, issuer ID, subscriber name, primary care provider, co-pays, and help desk phone number. Coordination of benefits, a provision ensuring the maximum appropriate benefits are paid to a patient covered under more than one plan without duplication. Primary insurance, the first insurance that the patient will use for claims. Secondary insurance, the insurance used after the primary insurance for any remaining claims. And birthday rule, a rule for determines child primary insurance based on the parent whose date of birth is earlier in the calendar year. Determining primary coverage. If a patient has one policy, then it is primary. If the patient has coverage under two plans, the plan that has been in effect for the patient for the longest period of time is considered primary. However, if an active employee has a plan with the present employer and is still covered by a former employer's plan as a retiree or a laid off employee, the current plan is primary. If the patient is also covered as a dependent under another insurance policy, the patient's plan is primary. If an employee patient has coverage under the employer's plan and additional coverage under a government sponsored plan such as Medicare, the employee's plan is primary. If a retiree patient is covered by a spouse's employer plan and the spouse is still employed, the spouse's plan is primary even if the retired person has Medicare. If the patient is a dependent covered by both parents' prescriptions and the parents are not separated or divorced, the plan is determined by the birthday. Two or more plans cover dependent children of separated divorced parents who do not have joint custody of their children. The child's primary plan is determined in this order: the plan of the custodial parent, the plan of the spouse of the custodial parent if the parent is remarried, and the plan of the parent without custody. Co-payments, the patient is responsible for all prescription deductibles and co-pays. So we have fixed co-pays, percentage co-payments, and variable co-payments. The National Council for Prescription Drug Programs Rejection Codes, NCPDP. Here is a very good list of codes you will get when you're trying to submit claims to the insurance company after the adjudication process. Claim adjustments may occur when the amount charged on a claim is not equal to the amount paid. 3 codes are used in addressing payment adjustments. So claim adjustment group code, claim adjustment reason code, remittance adverse remark code. The process of verifying that the prescription being processed does not interact adversely with the other medications on a patient's profile. If a warning is observed, the pharmacist is to be notified immediately to determine the proper course of action in filling the prescription, such as contacting the physician or continue filling the prescription. The pharmacist makes a decision based on the information on hand. A more in-depth discussion is found in Chapter 3. So filling the prescription, you're going to pull the medication from the shelf and check prescription label against the NDC number found on the bulk container on the shelf. Scan the UPC code on the bottle to ensure the correct medication was selected. Measure, count the medication. You should count in multiples of 5. Place the completed prescription container on top of the original prescription with the bulk container that has been pulled off the shelf. For packaging, select an appropriately sized container and pour the medication into the container. Place an appropriately sized child-resistant top on the container. For container uses, we have round vials for solid doses, list tablets and capsules, prescription bottles for liquids, wide mouth bottles, dropper bottles, applicator bottles, ointment jars, hinge lid or slide boxes. And then here we have USP classification of containers. And then we have child-resistant containers. We have unit dose containers, so you can see that chart. Prescription label requirements. Date when the prescription was filled, serial number of the prescription, name and address of the pharmacy, name of the patient, name of the prescribing physician, all directions for use of the prescription, generic or brand name of the prescription, strength of the medication, name of the drug manufacturer, quantity of the drug, expiration date of the prescription, initials of the licensed pharmacist, and number of refills allowed. So this is an element of a prescription label depiction here. For medication order label requirements, we have name and location of the patient. So this is like a hospital or institutional setting. So we'd have like their room number and their bed number. Trade or generic name of drug, strength of drug, quantity of drug for the outpatient prescription labels, expiration date of medication, lot number of medication. Sterile product label requirements, pharmacy name, patient name, date of filling, ingredients, total volume, directions for use, infusion rate, beyond use date. Unit dose labeling requirements, trade or generic name of the drug manufacturer, strength of drug, beyond use date, lot number of medication. Packaged drug labels, only enough medication as needed for a limited time period should be repackaged, and the following information is required. Name of medication, drug manufacturer's name, dosage form, strength of drug, beyond use date, and lot number. Manufacturer drug labels, National Drug Code number is a 10 or 11 digit number composed of 3 segments, where the first 4 or 5 numbers indicate the drug manufacturer, the second 4 numbers indicate the drug entity, and the last 2 numbers are the drug package size. Lot numbers are assigned by a drug manufacturer to identify a specific batch of medication. Expiration dates are assigned by the drug manufacturer, who guarantee that the medication is fully potent and safe to take based on product testing up until that date. Auxiliary labels provide additional information such as special instructions, warnings, or storage conditions to the patient. Auxiliary labels are printed with the prescription label and should be affixed to the container, such as that they do not cover any words on the prescription label. They may provide information on the administration of the drug. Some examples are, so avoid sunshine, do not freeze, take with food or milk, among others. Then we have common auxiliary labels for dosage forms. So for suspensions, we have shake well. That's one that's really important. Package insert requirements. A patient packet insert is an informational leaflet written for the lay public describing the benefits and risks of medications. A pharmacy is required to provide patient package inserts to all patients receiving metered dose inhalers, oral contraceptives, estrogen, progesterone, and isotretinoin. Information found on a package insert includes the following. So all of these warnings, precautions, adverse reactions, overdose, how supplied, among others. Medication guides. FDA requires that medication guides be issued with certain prescribed drugs and biologic products when the agency determines that certain information is necessary to prevent serious adverse effects. Patient decision-making should be informed by information about a known serious effect with the product, or patient adherence to drug directions for the use of product are essential to its effectiveness. And here's some examples of medication requiring a guide be provided to the patient. Patient counseling. So over 90 requires that an offer to counsel is made to counsel every Medicaid patient receiving a new prescription. State pharmacy regulations may require that counseling is made available to every patient. It is the role of the pharmacy technician to ask each patient if they have any questions regarding their medication, and then refer them to the pharmacist, or the pharmacist can come over and speak to them. The pharmacist is the only person who can legally counsel a patient. And while counseling a patient about their prescription medication, the pharmacist should ask about any OTC meds they're taking to prevent unnecessary drug interactions. Over 90 does not require the pharmacist to counsel a patient when they are purchasing an over-the-counter medication. OTC recommendations should be made by the pharmacist, not the pharmacy technician. Examples of durable medical equipment include walkers, wheelchairs, hospital beds, prosthetic devices, orthotics, home dialysis supplies, and surgical supplies. Pill counting systems are used to accurately count tablets and capsules for individual patient prescriptions. Automated dispensing devices are located in hospital patient care units, surgical suites, emergency rooms, long-term care facilities, physician office, and other settings. Features of an automated system: medications are contained and administered from single or unit dose packaging. Medications are dispensed in ready to administer form. Medications are available for administration to the patient only at the time at which they are to be administered. And medications are accessible to different categories of healthcare professionals with the ability to limit access based on policy or law. And then we have advantages and disadvantages of automated dispensing machine. So some advantages are increased safety, paperless, time effective. Some disadvantages can lead to staff frustration, difficult to implement across authority, expensive to purchase and maintain. So advantages and disadvantages of ambulatory care automation. So advantages allow pharmacists to provide clinical skills to the patient and reduce the amount of time checking prescriptions. So one of the advantages. Disadvantages: expensive to implement, requires a minimum number of prescriptions to be filled daily to be cost effective. Centralized automation systems that are located in the central pharmacy. They're used to improve manual filling of unit dose carts. Some advantages of that are improved accuracy based on barcode recognition, capability to track expiration dates, and some disadvantages: equipment cost, remodeling cost. Decentralized automation system used to dispense medications, return medications, and record medication waste. Along with the other two things. Advantages of decentral automation: improves accuracy because of barcode recognition, able to track expiration dates. Disadvantages: equipment cost, remodeling cost. Automated dispensing in a community system. We have Kirby Lester. Permits pills to be poured into from the top and allows lasers to count pills as they pass to the bottom of the machine. Baker cells, they're larger than the Kirby Lester. A log must be maintained indicating date of refilling the cell, the medication's lot number, and expiration date, among other things. Script Pro, both are robotic dispensing systems that have the capability to create a label, pour medications into the bottle, and label the prescription bottle. Automated dispensing in a hospital pharmacy. Examples are like Pyxis or OmniRx. Consist of drawers and cabinets that have pockets or trays that hold preset levels of medications, may be used for controlled substances, and pharmacy technician takes medication from the pharmacy to the ADS where they refill it. Hospitals may use carts that contain cassettes or drawers with each patient's medication. Pharmacy technicians are responsible for filling these carts under the supervision of a pharmacist. The Joint Commission states that the pharmacy infection control policies and procedures address the following: containment and disposal of waste, hand washing technique, microbial monitoring of laminar flow hoods, among many other things here. And then you're going to have a policy and procedure manual about the cleaning and disinfection program. And here's what all the different things do. The effectiveness of the pharmacy's cleaning and disinfection is measured through microbial sampling of both viable and non-viable particles found in a primary engineering control. A strict schedule of cleaning and disinfecting this equipment area must be followed to comply with USP 797. So we have cleaning ISO class 5, clean window stalls and all horizontal surfaces. Laminar flow hoods must be recertified every 6 months. Maintain all inspection records in the pharmacy. So non-sterile compounding techniques, blending, levigation, sifting, tumbling, among others. Equipment calibration, comparison between measurements, one of known magnitude or correctness made or set with one device and another measurement made in a similar way as possible with the second device. Weighing procedures using a class 3 torsion balance. So leave the balance in a draft-free area, lock the balance by turning a rest, set internal weight to 0. And then you can read the rest of those directions there. So weighing products using an electric scale. Check internal weight balance for the first use of the day. Turn on balance, remove the top ring of the draft shield and place the weighing boat in the center of the weighing pan. For measuring liquid volumes, choose properly sized graduates such as the quantity to be measured is not less than 20% of the total volume of graduate. When measuring a liquid, the technician should look at the bottom of the meniscus. So here's the meniscus. Preparing powders. Powders are prepared through the use of trituration and geometric dilution. Particle size is determined through the use of a sieve. So here is a sieve size and sieve opening. Preparing capsules using the punch method. You do have some capsules I believe you have to make in your lab kit. But if you come to if you're close to a campus, you can come in and we can actually use the punch method, like machine we have. Here's capsule sizes and a chart. This is what they hold. This is the volume they would hold. Preparing an emulsion using the wet gum method. Primary emulsion is formed by triturating 1 part gum and 2 parts water to form mucilage. Add 4 parts of oil and triturate slowly. Add additional ingredients. So the continental method, dry gum method, the primary emulsion is formed from 4 parts oil, 2 parts water, and 1 part gum, among other things you can read through. Preparing emulsions using the beaker method, water soluble and oil solute ingredients are mixed in separate containers, and you will make an emulsion in your lab kit. Preparing a liquid drug in a liquid vehicle, measure quantities of each liquid in a graduated cylinder, add drug to vehicle slowly, then shake and stir. Dissolving a solid drug in a liquid vehicle, weigh the solid and measure the solvent. Triturate drug if needed and dissolve in solvent. If needed, heat, gently stir, shake gently. Preparing a non-aqueous solution, prepare by dissolving alcohol-soluble ingredients in alcohol and water-soluble ingredients in water. Preparing syrups, heat method, heat must be controlled, works fastest, but not all ingredients can be used with heat. Preparing suspensions, a shake wall label should be affixed to the container, among all these other things. Preparing suppositories using the full fusion mold procedure. So if you come into the campus, we can definitely practice that. You will not do that in your lab kit. So you're going to melt the suppository base at a low temperature and dissolve the drug in it. Preparing suppositories using compression mold procedures. Weigh quantities of base and active ingredients, mix the suppository base and drug ingredients, and force the mixture into a special compression mold. Preparing ointments and cream, weigh quantities of each ingredient and place them either on an ointment slab or parchment paper. And of course, at the end, you're going to spread evenly in the container. You'll read through that. Here's properties of ointment bases. So greasiness, spreadability, water content, and then it kind of just goes through. So it's kind of a nice chart. Signs of physical incompatibilities in non-sterile compounding chart. And non-sterile compounding documentation requires master formulation record, official or assigned name, strength, and dosage form, and mixing instructions that should include the order of mixing, mixing temperatures, or other environmental controls. duration of mixing, other factors pertinent to the replication of the preparations as a compound. Sample labeling information that should contain, in addition to legally required information, the generic name and quantity and concentration of each active ingredient, assigned BUD, storage conditions, prescription or control number. You can read through all of this stuff here. And here is a formulation record. So equipment and supplies for drug administration. Alcohol swabs are used to clean an area prior to injecting a medication intramuscularly, subcutaneously, or intravenously. Glucometers are also known as a glucose meter or blood glucose monitoring device and are used as a home measurement system for the patient to test the amount of glucose in the blood. So you can read through all of those. Here's just some math questions that you can practice. And that will be it.